Guys, my name is Kylie Ray. I will be the nurse with you today on our online smoking cessation. I just want to say before we get started, congratulations on joining us today and taking the very first step on quitting to smoke. Before we get started, I want to take a kind of step back and let's talk about why smoking is bad. So, smoking increases your risk of cancer, such as lung cancer and bladder cancer, which many people do not know that smoking is your number one cause of bladder cancer. Smoking also increases your coronary artery disease. It increases your risk of atherosclerosis by it's the buildup of the fat and the cholesterol, which is also known as plaque, which kind of narrows your arteries. It does this because by increasing your LDL, which is your bad cholesterol, and it also decreases your HDL, which is known as your good cholesterol. The chemicals in the cigarettes increase the stiffening of the vessel walls, which can lead to increased heart rate. It can lead to increased blood pressure, which can also increase cardiac stress and cause a heart attack. So those are just a few things why, it's important to not smoke, to quit smoking, because smoking is not good for your health. And then let's kind of go over our brochure that's in front of us. We're going to talk about the smoking cessation, like I said, especially after a PCI. If you look at the little picture up on the top where it says quit smoking, if you just even look at the 20 minutes after smoking, so 20 minutes after you quit smoking, your heart rate and blood pressure will go down, which, as I said earlier, smoking does increase both of those. If you go down to the 1 year after quit smoking, it cuts your risk in half of coronary artery disease, which, that's another risk that you take by smoking. And then if you look over at the 10-year, you are half at the risk of getting lung cancer. So it is very important not to smoke, not only to help cause these, but also to help the healing process after your procedure. So if we go down a little bit where it says patients who have undergone cardiac catheterization and are smokers. So like I said, if you stop smoking after your PCI, it does enhance the effectiveness of the PCI and it promotes faster healing. It also, if you quit smoking, it helps reduce the risk of future heart attacks. It helps lower the risk of continuous chest pain. It helps improve blood circulation. It's very important to quit smoking. If you do continue to smoke, it does increase the risk of restenosis of your stent, which that is just the narrowing of the stent or vessel, can also cause you to have another heart attack in one of your other coronary arteries. It also increases your risk of thrombosis if you continue to smoke, which is a blood clot. And it also increases your risk of another cardiac event, such as a heart attack. So quit smoking. So the whole point of the smoking cessation after a PCI, this is to aim to reduce cardiovascular risk. We want to help improve your overall health, not just your heart, but like I said, it's also an increase of cancer. So we really want to help you to quit smoking. So how do we do that? How are we going to help you to quit smoking? Because I know a lot of people have a fear that they can't do it or it's going to be too hard. So we want to teach you some techniques to help you to manage these cravings, to manage the stress that may cause you to want to smoke. So one thing that we can do, we're just going to slide down right here, is a tobacco use screening. So this can also help the doctor or the nurse. They'll ask you some questions about your smoking, and this can also help them to figure out what would be the best for you. So it can be either let's cut back. If you used to smoke 2 packs, maybe we'll do a pack a day and then a half a pack and then a quarter of a pack. We can slowly wean you off. Or maybe the patch will help you, or gum, or there's medications that can help you. There are different types of counseling too. You can go on a group counseling somewhere. You can do something online like this to help to counsel you. There are hotlines too that you can call. One of them is the 1-800-QUIT-NOW. That is something you can call to help. There's also a state tobacco quiz, quit line. Sorry, not quiz, quit line. There's also a cdc.gov/quit smoke free. There's also tech supports to help you to quit smoking. You can look up to see if there's any groups around your area that you can participate in. You can, have a buddy. If someone else is trying to smoke, you guys can hold each other accountable. There are many things out there to help you to quit smoking. The big thing is knowing that when you quit smoking, especially after a PCI, it's the best thing for you. It's the best thing that you can do for your health. Some people like to stay active. You want to keep engaged in activities. You don't just want to sit at home and just sit there and think about it. Another thing that can help you is, figure out what your triggers are. If there's a certain stress trigger, try to avoid that trigger, or, stay away from areas that do allow smoking can also help you to quit smoking. So just kind of take it one day at a time. Don't try to just cold turkey it. Sometimes that's hard, especially people who have been smoking for 20, 30, 40 years. No one expects you to be done smoking, by tomorrow. So just try to take it one day at a time, and just learn how to manage all your stress. And then we are just going to do a quick 5-question quiz really fast. So, true or false, smoking cessation after PCI reduces the risk of future cardiovascular events. So, you remember when I talked about this a little bit earlier, that when you continue to smoke, it does increase cardiovascular events. So, yes, true. A smoking cessation after PCI can reduce your risk of these. And then what resources or groups are available? As I said, there's that 1-800-QUIT line. There is the CDC. There is also online groups for you to reach out to. The state tobacco quit line is also there for you too. What are some strategies to help support smoking cessation after PCI? Drinking and eating constantly, chewing nicotine gum, continue to smoke, scream. I'm sure a lot of us will love to scream. Drinking and eating and exercising is always healthy for you, but you don't want to constantly be drinking or eating. So the best one for that would be chewing the nicotine gum. And then what is potential consequence of continuing to smoking after PCI? We're going to select all that applies here. So you got an increased risk of thrombus, which is that blood clot, increased risk of restenosis, which is the narrowing, increased risk of future cardiac events, such as another heart attack, and then improved lung function. So this is a potential sequence, I continued to smoke. So if we continue to smoke, obviously our lung is not going to function better. It's not going to improve. But we are in an increased risk of thrombus, increased risk of restenosis, and increased risk of future cardiac event. So that is A, B, and C. And then list 3 common pharmacological aids to assist you in smoking. As I mentioned, there's the nicotine patch, there's the gum, there's medications, and there's even lozenges too to help you to quit smoking. I hope you guys found this very informative, and I hope you guys continue to work on your smoking cessation. Have a good one. Thank you.